Hello everyone, and welcome to another episode of Tiny Matters with Dr. K. Today, we are talking about something deeply personal and so often hidden: postpartum depression. The arrival of a child is often portrayed as one of the most pleasurable, memorable experiences in a family's life. Sometimes the reality is a little bit different to what we see on social media. Helping me dive into this topic today is clinical psychologist Lerato Rasoaisi, who sits with parents as they navigate the complexities of emerging parenthood. Thank you for joining us, Lerato.
Thank you for having me back.
So to start us off, from a psychological perspective, what is postpartum depression and how does it differ from the normal baby blues?
Okay, so postpartum depression is actually a clinical disorder, right? It's a part of a mood disorder, so you have to be diagnosed. So it's not the same as the baby blues, which any mommy can go through after giving birth, and the baby blues typically takes about between 10 to 14 days. And after that, it will regulate. Your mood will start to feel better. You'll start to feel less of those symptoms, which are like sadness, a bit more tearfulness, anxiety, all that stuff. But then with postpartum depression, we're dealing with actual depression. So it will go on longer than 2 weeks, a month, 2 months, and longer, sometimes even a year.
The main difference is time, right?
Yes, that's one of the main differences. So time and severity.
Okay.
So if you are feeling a bit sad and a bit teary with the baby blues, with depression, with clinical depression, it will be persistent sadness that is inconsolable, that is not really linked to a particular event, but just like feeling sad day to day, not connecting with baby, a struggle to bond with baby, not being able to sleep when the baby is asleep. Some mothers, mostly, they're able to kind of catch like a snooze while baby's sleeping, feelings of guilt, sometimes feeling suicidal, and sometimes even feeling homicidal towards the baby. So you kind of want to run away by saying, I want to take myself out or even the baby because I'm overwhelmed.
Yeah. Okay. I think that distinction, right, between normal baby blues and postpartum depression is so important because so often, mothers are feeling sad and anxious and teary and overwhelmed and are kind of taught by society that it's something that we need to just push through, like it's okay, it's just hormones, you're going to be fine, just push through. But it obviously becomes an issue when it's something that happens and persists beyond, like what you said, the normal 14 days, I think you said.
Yeah, of course. I mean, because going for more than 3 weeks feeling a certain way starts to hinder on your functioning, right? Your relationships, your ability to be a mom, to wake up and take care of baby. So one of the things that is really important about diagnosing any condition is how it impacts your functioning. So you won't be able to do that. Often I say to moms, if you are experiencing depression or postpartum or whatnot, you kind of need to look at the day-to-day things that you normally are able to do. So if you're usually able to cook or, wash the bottles, the baby's bottles, or I don't know, go for a walk or whatever, and all of a sudden you're not able to do that for an extended amount of time, then, that's, you're not yourself. So that is really not okay.
So from your experience, how common is postpartum depression? And why do you think so many women feel like shame and loneliness when they experience it?
So it is quite common. 1 out of 10 women will have it after having a baby. It's quite common. And, the shame linked to it is because a lot of the time there's this idea that when you give birth, it's supposed to be the happiest time, and, I'm almost like, even some medical professionals will say the same. And I'm like, I beg to differ. Is it really, or is it?
I absolutely beg to differ.
Yeah, because is it something that we call a positive trauma? Because it is good. It's a great thing, but it's hard, very hard. And your body going through all those changes, and then all of a sudden the baby's out and the hormones then go flip, the other way around. It's very hard. So maybe we're not supposed to be as happy as we think, you know? And I think that idea that we are supposed to be happy and then you're not kind of brings a lot of shame, because it's like, why am I different? You know, am I a bad woman or mom? Am I, do I not love my baby? So all of those ideas are kind of shattered, and then you feel bad in yourself.
So maybe more like a societal thing or a stigmatization just by everyone around us, because like you say, it's a positive trauma. It's seen as this thing that's supposed to be so wonderful, right? And perhaps that we don't talk about it as much as we ought to. You know, I mean, I'm the first person to tell everyone how severely I suffered from postpartum depression. You know, having had my kids, and obviously it was different. They were born very small and they went into ICU, etc. But I remember like not feeling like this is the best thing that has ever happened to me in my life. You know, I remember looking at them and being like, "Oh, what? What is this? What is this? Who am I?" Like not recognizing myself, not recognizing my body, not recognizing my mind, and just having to navigate just all these feelings that were so different to what I expected them to be. I think, kind of going back to recognizing the signs for parents. As you said, we can all agree that early postpartum time is exhausting and it's challenging, you know, for everyone. Will you please go through again just like what the signs are that I'm leaning more towards depression, I'm leaning more towards I actually need help for this?
Okay. So the duration one is very important, because the baby blues will look the same. So if 2 weeks hits and you're still feeling those feelings, that's the first kind of like eyebrow raise that one should have. And I always say to partners that as the dad or the mom, whoever's staying with, you know, they to help you, they also need to be quite aware, because they might not be aware, the mom might not be as aware as someone who's like next to them or living with them. So 2 weeks mark, and then increasingly just feeling quite overwhelmed, and that, you know, something that you don't feel like you're going to get the hang of this ever, you know, and then feeling very sad, very teary. If you actually start to feel like, I don't like this little person, you know, I'm struggling to connect. I feel like there's no love, you know, between them. In fact, I feel scared. Sometimes I really feel like I don't want to be around them, right? Because moms who are just going through baby blues or just overwhelmed, they will say, yeah, I get tired and everything. But when I ask them, are you bonding with baby? They'll be like, yeah, like I miss him when I go to work or whatever. So not feeling those feelings towards baby is also a big one. And just like the anxiety of like, am I going to be able to do this? If you're highly anxious and there's no belief that you're actually going to be able to do this. So typically depression symptoms are big, you know, the appetite, not being able to sleep, feeling suicidal, feeling homicidal towards baby. So all those things, because the other thing is that it's so hard to diagnose, you know, not like, obviously, it's tricky. It's challenging to diagnose depression in someone who's just had a baby. Because they're not really sleeping, and that's normal. And they might not have an appetite because they're just anxious and there's a lot going on.
Or they might eat too much because they're breastfeeding.
Exactly. Right. So, but you kind of need to see all these things together and to be able to diagnose or see that, okay, look, my wife might be struggling. Let's see what we can do.
I think I've realized that, you know, parents are facing a lot, mothers are facing a lot. You know, there's often so much that you're navigating besides just this new baby. You know, there's maybe family conflict, there's financial challenges, there may be challenges at work, for example. And I think that in a lot of ways is going to affect your expectation, what your expectations were around new parenthood versus the reality of what's actually happening. What actually happens? Like what is a way that we can navigate it when our expectation of what parenthood should be doesn't match our reality?
I think what's important is to kind of be compassionate to self and understand that we don't go through things the same. So if you see, also social media is kind of hard. If you see this mom who looks like they're very like much coping and whatnot, then you are like, why am I not coping? But you need to understand that maybe two realities that are opposing can, you know, exist in one thing. That yes, it is hard, and maybe you don't feel like you're coping. Maybe actually you're not, and you need like a helper. You need a second helper. For some moms will have like 3 kids or 4, and it's like, why not have 2 helpers? That's okay. You can still be a good mom, but still be struggling. Does that make sense? It does. You know?
No, absolutely makes sense. Like anyone who's had enough conversations with me knows that I always say, aren't we just pretending to be coping all the time?
And it's nice that, I mean, even you and I, when we talk sometimes, you'll be like, I feel like, friend, I'm not coping. And that's, it's so good to hear another mom saying that, because we look at each other and everybody thinks that she's coping, she's so great, you know. But sometimes you're not coping, and that's okay. And it can exist that you love someone and still not be okay.
You know, just the other day, actually it was probably yesterday, I had a conversation with one of my moms, and she was telling me that she feels like, you know, she's struggling silently. Like on the outside, she has to give this impression that everything is fine. She's got this cute baby and family and in-laws and everyone and she has to give this impression that everything is fine. But behind closed doors, she told me, you know, I'm crying all the time. I'm anxious all the time. I'm hardly eating. I'm hardly sleeping. And I love my baby, you know, in my mind, but in the reality of it, this is really, really so much harder than I expected it to be.
And that it's not showing up like she loves, I like what you're saying, she loves the baby, she knows she does, but it's not showing up in her interaction or relationship with baby. And
it made me realize that unless we are talking about it, so many women, so many mothers, and possibly fathers as well, are struggling with depression during this postpartum period. So another fear that I see families and parents and mothers having is a fear around bonding, you know, and I guess it ties in with the guilt and the shame that comes with postpartum depression, is the fact that you genuinely feel like you're not bonding with your child. How can postpartum depression affect early attachment and bonding?
Very important one, because it does, you know, and it's hard because these mommies are not, you know, their moms are not like pretending to be sad, but they literally are struggling with their own emotional, you know, stuff inside. So it will definitely do that, because, I mean, the mom's nervous system is not regulated, right? And they are not picking up on the baby's cues. So it's stuff like that, you know, because a baby, the cry of a baby can be different depending on if they're hungry or if they're tired or, you know, need to be soothed. And when mom is very depressed, they cannot pick up the differences, right? Because they're not in tune. They're not calm enough and kind of like, you know, like there to be able to do that. They're more within themselves, right? So that will be hard for the baby, and often it shows up later in kids being a bit like temperamental in their temperament, or not being able to self-regulate as easy, and then more behavioral stuff as they grow. And that can also then make mom feel even more ashamed and, you know, kind of depressed even more, because then they're like, why can't I do this for my child, right? And because they actually can't tell what in terms of which cry or what the baby needs, it then perpetuates the whole thing, because the baby will be crying longer and
so, to interject, in fact, one of the main known risk factors for a baby with colic is a mother with anxiety or depression. So and it's a known thing that a baby who is described or diagnosed with colic and cries all the time, often there is a link to a parent that is anxious or depressed and crying all the time. Which is interesting. I've always been like, well, if your baby is crying all the time, then you're going to cry all the time. You know, if your baby is colic, then you're probably going to be depressed. So it's a little bit of a vicious cycle. Like, I'm not sure which came first.
Yes, that's what I was about to say. Which one comes first? That's, big question.
How do we navigate that? Like, how, as a parent who is struggling with postpartum depression, who is struggling with bonding with your child and struggling with that early attachment, what do we do? How do we make that better?
Okay, so I think the first thing that's important is just as a treatment or kind of like an intervention for postpartum depression, which we'll obviously go into detail after this, is that help is needed, right? Intervention is needed. And once that starts, that can then be the start of how we can help mom kind of attach better or bond better. Mom can't bond better if she's not getting sleep, if nobody's taking baby, so that she can get a bit of sleep, or just be in herself without needing to worry about baby. So getting help around the house, someone that she can talk to that will understand her, maybe starting therapy, or just like if she's now shared with other people, so there's no shame in now talking to her friend or her mom or her husband. So that's important before you even help mom bond, is to get her help first, right? We have something that's called parent and infant psychotherapy. And so that helps. So we sit with mom and mom is with baby. So we do the whole thing where we can help mom bond, and we can kind of almost be a third eye where you kind of interject and say, okay, mom, I think do that in this moment. When baby's doing this, I think baby is asking you for this, or I think baby is experiencing this. So maybe reach out by this, and that can help over a long period of time. So those kind of things are important, but support is really big. Mom just needs to take a 10-minute walk in the sun sometimes, and not worry that, people will be like, in African culture, even getting out of the bedroom sometimes is like a taboo.
An abomination of religious laws.
The grannies will not be happy with you. But sometimes you need a bit of vitamin D, and just to not hear the baby crying and all of that.
I love how you've mentioned, family support, because I think that postpartum depression is often just so stigmatized and almost shunned upon by society that, your family may not even know that you're suffering. They may not know how to identify the signs, and they may not know how to support you when they see that it's happening. So I love how you've mentioned that. I always say delegate as much as possible. It's difficult, but I think the ability to just say, I'm just going to take a long bath. Can somebody just watch the baby? May go a long way, right? What would you say to mothers who already feel like that early attachment and the bonding has been so disrupted by their sadness, who may be carrying a lot of shame and guilt around the fact that they are feeling this way, like you say, that the ability to love my child and still be overwhelmed by the situation can coexist. What do you say to them? Is it too late? Must we just accept that our children are doomed? Or what do we do now?
So yes, of course, it's never too late. So we can still do the psychotherapy with the child, the toddler and all of that, because sitting with a psychologist in the room and still doing play therapy, we can still kind of like intervene and kind of like coach in a way on what to do. And it's not too late. The child is still developing, so they can still, and the bond can still form. So the other thing I usually say to my patients is that, if you bring in your child for play therapy alone with a therapist, that's not only good for the child, but it's also good for you, because we tend to then see the parents in intervals every 5 sessions. We'll see them. Then we can give the parental guidance. Then we can kind of help you to understand your child better. And then you can practice those things back at home, which will be helping you and the child to bond, right? And it's more the quality time versus the quantity of time. So parents then think, I've got 3 kids, I really can't juggle this much. But just having that quality time and trying to implement what you've kind of learned in the interventions can really, really go far.
Okay. I love that. And I think, a lot of what therapy is, your time, your time that is protected. I like that it could be done with the baby, because then it takes away the guilt element of the fact that I'm dealing with this thing, and now you've separated me from my child.
Right?
So I like the idea of, mom and infant therapy, because I think it's not separating you from your baby. And like you say, there's a third eye kind of watching over you, together with the fact that it's a protected time where you can just talk about what you're feeling.
Very important.
I think,
because a lot of moms have anxiety a lot about coming for therapy and leaving their babies, because it is it is like part of us, what's the word? It's a primal thing to want to be around your baby and be with them physically. So whenever you're like, leave baby at home, it's like, oh, you know, and
can't do that.
Yeah, and then they'll rather skip the therapy. But you say, sometimes I'm not actually even doing the psychotherapy with the child, but I'll just say, no, bring the child. It's okay in the session. And sometimes it helps, sometimes it's a bit distracting, but it depends on the patient.
Okay, so let's say I'm a mom, I'm sitting at home, I'm watching, and I realize, okay, this is actually describing me. It's been more than 14 days, I have a newborn, I feel I'm not bonding, or feel like I could be bonding better, but I'm sad, my mood is down, I think of harming myself, or I may actually think of harming my baby. I'm anxious, I'm overwhelmed, and it's just not getting better. What are the next steps? What do I do? Where do I go from here?
Okay. Firstly, I want to say to those moms, you are normal. You're normal. You're not a bad person. You're not a monster. You're not less of a woman. You are normal, because this happens to a lot of women.
1 in 10, like you said.
Yes, 1 in 10 globally. And it's like you know, you're not less of a woman, you know, and it really is okay. It's a normal thing to happen. And women who also have, I feel like I need to say this, women who also have depression or an episode before, so they've been diagnosed with depression or bipolar before the baby was born, they're more prone to having it, right? So stuff like that, I think women need to know that it's not because you're a bad person or a bad woman, it's because there are vulnerabilities, you know, and things that play into it. So I want to say that firstly, you're not a bad person. Don't let anyone get into your head and judge you, even if it's your partner saying you need to get over this or you need to be stronger, or your mother-in-law. Don't let anyone make you feel less than, right? And then obviously now you've gotten to this place where you know something is wrong, get help, right? If you feel like your partner is a safe space, or your mom or anyone close to you, that's the first place to start. Tell someone you trust and you know they love you. And then the next step is obviously seek professional help from, you can talk to your gynae, or you can talk to a psychologist or a psychiatrist, right? Or a GP. And then from there on, you'll be getting either starting therapy, but then if the mood and all the symptoms are very, very severe, then we can start you on medication as well. But then obviously that will mean leaving the breastfeeding. You have to stop the breastfeeding. But I often say, you know, which one is better? You know, this is what I always say, because you can carry on being depressed, not bonding with your baby, and really struggling, and maybe even being depressed for longer. Or you can put your baby on formula, and yes, you know, but it's 2026, formula is good now, you know. And then you can kind of mourn that loss of not breastfeeding, but be better and like be well, and actually be able to bond with your child and have your family be like well.
Yeah. And what does that recovery look like typically for postpartum depression?
Long, you mean duration?
Yeah.
Look, it can be long. For some women, it can be like a few months, and then they start to feel better, especially if the support is really good and they now have extra people helping with baby and. For some people, it can be really longer. It can be a year, it can be 2 years. And I mean, they would be coping better and getting better, but it could still take longer, you know, because the baby is still demanding. Even at 2-3 years, babies are still like, toddlers are still asking for milk, and they're still waking up. So, and that's normal. So it can still be hard because of all of those factors.
Okay, so don't rush the process, basically.
No, don't rush it.
And kind of beyond the therapist rooms, beyond seeing a psychologist like yourself, beyond seeing a psychiatrist, my apologies. What else? What is the role of communities, of families, of partners in supporting mothers through postpartum depression?
There's a phone. It's probably mine. Sorry.
It's okay. Can you give that question again?
Okay. All right. So, beyond your rooms, beyond the psychotherapist rooms, beyond the psychiatrist rooms, what is the role that the community, that partners, that parents, that friends can play in supporting mothers through postpartum depression?
Definitely support. I know that's been like my big word, but it's literally, it takes a village. So support is very important. Not being judgmental and understanding of this mom, that sometimes people will say, yeah, but we all go through it. We're all, I have 4 kids or 3 kids and I didn't have postpartum depression.
Yeah.
But it's not the same for all of us. So,
and maybe you had it, you just didn't recognize it.
Exactly, right? So it's that, just not giving this mom a safe space just to go through what she's going through. But things like, bringing a meal to your friend or your your neighbor or whatever, so that she doesn't have to cook for her whole family, and just being a safe space. Support groups are also really important. So if there are churches and like other, kind of organizations that have those things, that's a good support structure. And just talking about it and making sure that the stigma is kind of like dismantled, broken down. Yeah. So I think, and can we speak about dads before we close? Is that possible?
Yes, because absolutely.
I feel like we forgot about them, which is telling in itself that typically in this type of topic that has to do with babies and like maternal things, we forget about them. They can also have perinatal depression. So they can also be depressed, particularly young dads, dads who are already anxious about whether they can be a dad or not, whether they're going to be able to contribute financially and cope financially. And if they have struggled with depression before as well, or are typically struggling with anxiety, so they're also going to be depressed. So that is also important, to give them space as well, and not be like, well, you were not carrying the baby and you're not breastfeeding. That's important.
No, absolutely. And I've seen it happen so many times. And I think the sad part about dads suffering from perinatal or postpartum depression is the fact that it's, number one, almost not seen as the thing that's important. It's not validated enough. So nobody even knows what it is. You're just you're just an absent father. In the eyes where I've said this so many times, that moms almost become moms when they fall pregnant. You have this baby growing inside of you, and you have this baby that's kicking, and you have this almost like realization that is gradual, that there's a human coming along, and where dads become dads the moment the child is born, and you actually see this human, and your brain goes to 100 places at once. And there's this time where bonding is not really a thing, because all the baby wants is baby's mom.
Exactly.
And then you're just kind of not really sure what you're feeling. Add to that the pressure of, provision, the pressure of being present, the fact that paternity leave is like half a second long, so there really isn't time to learn, there really isn't time to bond and to adapt to this very real, very new challenge. So I think that's such an important thing, to talk to depression in dads, because that can absolutely happen as well.
Definitely. And quickly, what it looks like is that it will look slightly different to the mom's one. So they might not be teary and crying and like super sad, but they might be irritable more. They might be going out to see their friends or to drink more, or working more, because they just feel like when they're at home, they're overwhelmed, and they also don't seem like supported at home. So that's some of the stuff that can happen with dads.
In recent times, we've seen so much on the news about mothers that, cause harm to their children. We heard of that case of the mum that killed 3 of her children. We've heard of mothers harming themselves or harming their partners around this time. And for me, I know there's, it's always so polarizing. There's always, very many different schools of thought, where one person is like, what was going on? Did she, lose her mind, etc. Where for me, I've always just felt incredible pain, like incredible empathy for these mothers to have been at that place in your life where it feels like the only way out is to harm my child, or to harm myself, or to harm my partner, right? And I always think that there must have been so many red flags that were just not picked up. You know, there were so many flags, so many signs that something is wrong that we missed in that process leading up to, you know, very unfortunate outcomes. What are some of those red flags? What are the flags that say to us, okay, this is not, let's go to a therapist's office and sit and chat about it.
Yeah.
What are those flags that say, okay, now we need to do something and we need to do something serious?
Urgent signs would be suicidality first, that mom, you know, is feeling like she wants to, she wants to take her life. And then also mom feeling like she'd want to take the baby's life as well. And like you said, sometimes with the other children, because often there's the fear of, if I'm gone, who's going to take care of my children?
Oh, that's so sad. And that would come up in conversation, right?
Yeah.
In conversation with people that you trust.
Yeah. With people, in therapy perhaps, but
No,
often...
I mean at home, right? Like how do we pick up the red flags in a mother, in
That's
our
the
friend,
hard thing.
in our
I don't
sister?
I don't think people feel safe to tell their partners or their mom or aunt who's helping or their helper that they're thinking of taking their own life. I think the red flags.
Sorry to interrupt you. Perhaps maybe not like that. Perhaps maybe you say something like, "Sure, I wish I could just end this. I wish I could run away. I wish I could run away.
This. Yeah.
I wish I could just go away and never come back."
Yes. I think that is something, though, you're right. Those phrases are more what would be the signs versus someone being a bit more explicit. I wish I could run away is the bigger one that I usually hear. I feel like this is all too much. I wish someone could take, you know, this away from me.
Yeah.
And I think like the more the mom does not want to be around baby, the more, you know, urgent or kind of like prominent it's becoming.
Yeah.
So that, and the more they just like distant and sleeping or almost just don't want to be part of anything about taking care of the baby, I think it's starting to get really serious. Sometimes the mom does get psychotic. Sometimes they'll start to hear things that are not real. They start to hear baby or something or voices or whatever. That's actually a thing as well.
Sure.
So that would be definitely red flag. You know, take your partner or mom to casualty and let it be, and it's an emergency at that point. Yeah.
Okay. Sure. Okay.
I know. Sad.
Okay, so I'm a parent at home and I'm feeling numb, or I'm feeling ashamed, or I'm feeling guilty, or I'm just so incredibly sad at expectations versus reality. You know, what I thought this time would be and how it's actually turning out.
Yeah.
What would you say to me?
So I think, you know, knowing that you're not a failure, you know, you're normal, you're not a failure, you are simply someone who's struggling, and it doesn't matter, even if this is your third child or fourth child, it's okay to not be okay, and it doesn't mean you're less of a woman. You're not a failure, you know, and you still love your kids. You still love them even if you're struggling.
Yeah. Again, it's possible to hold love and overwhelm in one place.
Exactly.
Thank you so much for sharing your insight and your compassion on this topic. I don't think that it's a topic that happens nearly as often as it should.
No, I don't think so at all.
Conversations like today matter deeply because they remind us that parenting is difficult. You are not alone, and there is help available out there. To anyone that watched today and is struggling through the season of parenthood, reach out, ask for help. There are channels available that can help you. Thank you for joining us for another episode of Tiny Matters with Dr. K. Until the next time, stay kind and stay curious.